Here at Dartmouth Health, we're able to provide comprehensive cancer care for our patients locally. We do everything. It's not broken up between surgeons and medical oncologists.
And we have a good collaborative approach for each individual patient.
You might be seeing one of the GYN oncologists. We have a nurse practitioner on our team. We have a physician's assistant on our team. We have nurses, and then there's the pharmacists who play a huge part in the role of giving patients chemotherapy.
We managed to attract really top-notch cancer providers from all across the world.
It is a good collection of individuals providing selective care for women who have gynecological cancers, which is nice to streamline the care that they're receiving.
We've been designated by a U.S. News & World Report as one of the high performers for endometrial cancer surgery and ovarian cancer surgery, and we're very proud of that. I think that really speaks to this team approach and having the expertise in all the various aspects of the team.
We've been incredibly fortunate here in the Cancer Center at Dartmouth Health. We've achieved a very top rating in the top 5% of national comprehensive cancer centers across the U.S. 4 years in a row. And that's really telling you that patients are feeling heard and respected and cared for and just, I think, appreciated and loved.
Patients who have good relationships and good rapport with their physicians, they feel more comfortable in being open with their doctors.
That they're actively being listened to, they're receiving compassionate care, and that they're empowered to make their own decisions and fully understanding their diagnosis, their treatment plan, so then they can advocate and ask the questions that they feel are important to them.
For my partners, they have open door policy, walk and discuss any patient's care to kind of help allow us to get the patients the care that they need.
And that really puts us in a position as experts of the gynecologic organs, oftentimes the one to have followed the course of disease from its very beginning, to really be the most qualified to understand what are the symptoms that a patient's having as a result of her cancer or her treatments, and how to monitor her and move into a surveillance phase once we're done with her cancer treatment.
We are all very focused on the cancer care for that patient, and that does expand beyond their diagnosis, and so that really involves their family and transportation and food security and where they're living. And when they leave the visit or exit my care and say they feel so much more confident with how to move forward, they feel confident with the care they're getting, they feel confident with Dartmouth Health and with my care, and that gives me great satisfaction.
People really say, hey, I'm here for cancer, and I'm here to take care of women with cancer.